Not many people know that a simple itch could actually mean that this is one of the first symptoms of cancer. It's very frequent to receive in a hospital or in a practice a simple itch that sometimes could be an alarming sign of a starting cancer. Something that if you knew about could actually save your life, because the sooner you recognize a condition like this that is dangerous, the sooner and the better your treatment can get. So what are the 6 symptoms of itchiness on your skin that could actually mean that you have a serious condition like cancer? What is the alarm that shows you when it should be happening, how it's itching, and what exact part of your body is actually bothering you? Most of the time, itching is a trivial situation. It might be an allergy, might be dryness, stress, but sometimes the body is trying to tell us something very deep, something deeper, something that goes way into our blood, our cells, organs that are or might be failing, like the liver, pancreas, kidneys, some of these detoxification processes that are not working, and some of these toxins that might be accumulating in certain part of your bodies, your hands, your feet, your belly, sometimes all around your system. This could mean, if it itches a certain way that I will describe to you in this video, it means that you need a hospital or medical attention, and you need it fast. Now, before I continue, please make sure to subscribe to this channel. I've always been surprised at the amount of people that watch my videos but are not yet subscribed. Maybe a new video that I do publish with something I say as interesting as this could actually, with a very simple phrase or something that I show you, could actually save your life. Having said that, let's move on to the video. Number 1, itching on the palm of your hands and the soles of your feet. In many occasions, I have patients that tell me, "Doctor, I have an itchiness on the soles of my feet or the palm of my hands." The first thing that I really think about is, how is that liver working, or how are those pancreas filtering their blood? Remember that the palm of our hands and the soles of our feet are the most distant part of our bodies. This means that the irrigation process is very slow and very sluggish as farther away from the heart that you might be. In this case, the palm of your hands and the soles of your feet. Now, if you're feeling itching in any part of these in your body, this could mean, it might be a condition that is indicating some type of serious problem with your liver. It could be a liver or biliary disease, a pancreatic liver or gallbladder cancer. It could be due to a very wrong situation or not a most optimal situation of detoxification that all these organs have in order for you to stay healthy. Look for something like HepaClean, Thistol Essence, Colupgon, or even maybe Purify You and Uriescence from Fineland at finelandvitamins.com. If you haven't done any of these detoxification natural processes, this might be a good thing or a good time to do so. Number 2, itching all around your body but without a rash. We are used to seeing a rash when we itch, right? An allergy, a situation where we feel that maybe something has caused us an irritation on our skin, maybe dryness of our skin. But in some occasions, you might not even see a rash. And if this is happening to you, it might be your immune system that is needing some help. In this case, we, as doctors, might see something that might be indicating a lymphoma, leukemia, or even the metastasis of our internal organs due to a certain type of cancer. In this case, the immune system is releasing inflammatory cytokines, inflammatory substances that trigger itching. And in this case, again, and what you want is exams that are going to show you just exactly that. You want a complete blood count. You want a CT scans of your lymph nodes. Maybe it's a lymphoma. Maybe it's some type of other cancer that needs to be addressed, and you need to check to see that immune system is working properly. If you can, make sure that you're taking some type of supplement that will keep your blood healthy, that will prevent any of these conditions due to the lack of antioxidants that you might not be taking. Something like Green Shot, Red A+, multivitamin, or even D-enzymes from Fineland at finelandvitamins.com. Number 3, itching with jaundice. Jaundice is basically a very fancy word to say that you are turning yellow on your skin. You're turning yellow, and this might be a situation that is indicating something is not right with that detoxification process. Again, it could be a pancreatic cancer in some occasions, which is about 70% of the cases also, and cancer that is a very hard thing to take away from a patient that is already in the course of seeing that full-grown disease being and taking over their body. Pancreatic cancer is something serious and is something that you need to pay attention as soon as you see that itching with some jaundice. You might see a yellow skin or eyes due to the excess of bilirubin. You might need a pancreatic ultrasound, an MRI, or tumor marker test that will test for CA19-9, just specific cancer markers that will tell you if there is a cancer or something worse that is happening inside your body. If you want something natural to help you with this, look for something like metaglucose, berberine, neuromatrix, dia-8 from Fineland at finelandvitamins.com. Number 4, itching in the anal or genital area. And this might not be fun at all. If you are experiencing itching in some part of that area, which is the genital part, it could be a symptom, could be, you have to get yourself checked by the way, could be colon cancer, vulvar or uterine cancer, or even prostate cancer, conditions that are no fun to deal with. These are actually some of the most common types of cancer in the world. So many of the people that are suffering from these conditions are seeing that anal itching and that genital area itching. And although it might look as something normal, it's not. You need a blood or stool test. You need to check on and see how your stool is changing. Maybe if it's changing during some time, maybe you're checking yourself and you're seeing that you are finding blood in the bathroom, and this might need more recommended lab tests like a colonoscopy. You might need to visit an OBGYN if you're female, or a urologist if you are male. Remember, look for something like Paraflush, look for something like Oxy Elixir in capsule form, Guana Boost, or Graviola Gold, supplements that will help you combat any parasite and at the same time keep you healthy without, or keep you preventing any type of cancer that I just mentioned. Number 5, itching with unexplained weight loss. Unexplained weight loss is always an issue. Some people are happy that they are losing weight. The reality is that it's not something to be happy about. You could have diabetes, you could have cancer, especially if you're growing a tumor. This tumor is absorbing and taking in all the energy it can. It's taking in sugar, carbs, your food, your protein, everything to grow. And that's why you might be losing some weight with that unexplained weight loss. It's not something you should be seeing. It could be a systemic cancer of the lungs, stomach, a lymphoma. If you lose more than 11 pounds, for example, or more in 3 months, this is something that needs to be studied, and you need a doctor to do so. Look for maybe exams that you're going to take with a full metabolic panel, weight body CT scan, or a colonoscopy, endoscopy. You have to check everything to see where that weight loss is coming from. It might be even diabetes, something that is less dangerous, but yes, has to be treated nonetheless. Number 6, the itching of some type of lymph node that might appear. And yes, any type of growth on your skin, on your breast, between your legs, on your neck, anywhere in the body has to be taken seriously. This is not something normal. Maybe you can see it on your armpits, between your legs, maybe some other part of the body. And lymph nodes are never a good indication that something is happening well, if you want. It could be a disease, it could be a cancer, it could be lymphoma, it could be a metastasis or any other type of cancer. And this is always very suspicious and needs to be taken seriously with a biopsy. Look for a doctor, look for a hospital. If you are feeling that itching and it's not something normally you see every day, even worse, go and have yourself checked. Don't forget to give yourself a like button, don't forget to share, and I'll see you in the next video. Take care.